Change 3. Personalised care and support planning. A different conversation with people which is more about them, what their needs are, and what they want to do in their lives. Building people's confidence and skills so they are empowered to take more control of their own care and support plan.
When my mum was diagnosed in 2012 with vascular dementia, we were kind of left hanging a little bit. There was no information or support options available to us. It was just a bit of a sort of chasm. Information is so important. You want people to develop their skills and confidence and knowledge so they can better self-manage their health and well-being. Putting people first and listening to who they are and what they need to live their lives. It's not just about an existence, it's about having a life. If you do the care and support planning well, right from the beginning, it becomes the beating heart of the whole process. The individual is leading it, and a time and a place that suits them. It's about outcomes and not provision, and shape the way that services are delivered, and not just driven by the system. Because care could be delivered at home, in a place where it's safe and familiar to the individual, which I think is really important.
Finding out first of all what the person wants to achieve in their lives, and really understanding what outcomes they want, rather than saying you've got X hours of a personal assistant or X hours of this. They're dictating what they really want in the future, and it's led to really things that people didn't realise were important, so it's really positive.
It will make it better for people because they will be at the centre of their plans. Support plans have to be flexible. A plan doesn't get written and stops. It's an ongoing process, so it has to be reviewed and updated regularly. And a plan really explores your whole life, not just one aspect of your life, and letting that person be in control of what they need.
And actually waiting to see what's important to the person, and that's quite hard for someone who's worked in a different way, and also focusing away from someone's disabilities and more onto their abilities.
Shifting control to the person will mean changing the way people work with individuals and their families. Seeing people differently and enabling them to take more control, improving their skills, knowledge and confidence. Using technology and communication tools to help. For young people, it means looking at their education needs as well as their plans for adult life. For everyone, it means thinking about their life as a whole, including work, a place to live, and a social life with their friends and family. For more videos, see www.youtube.com/the NHS England.